Hello, this is Bobby Kimbrough, and welcome to Off the Cuffs again. I'm very fortunate today to have with me Dr. Oliver. Welcome to the show.
Thank you for having me. It's a pleasure to be here.
I appreciate you. So I was reading your bio. It's very impressive. I see that you're a graduate of Duke. Just joking.
No,
Carolina. I know. I just thought I'd start off with a light humor. I saw that you're a graduate of Carolina University. But while I know your bio, a lot of people know who you are. But just share with us who you are. And I don't want to miss your title, but just share with us who you are before I go into a few questions that I got on my mind for you.
All right. Well, I'll start. Thank you for having me again.
Pleasure's mine.
I'm an OBGYN here in town. I've been here for 15 years in practice at Novant Health Woman Care. And over the years, I've taken various leadership positions, and now I have the pleasure of being Executive Vice President at Novant Health and President of our Physician Network or Medical Group.
Wow.
So I get to lead all of our ambulatory clinics across our entire footprint. But that's not who I am. It's what I do. My background goes back to Eastern North Carolina. That's my family. I was born and raised in Rocky Mount, North Carolina.
Rocky Mount.
Family's still there. And then came through Chapel Hill for undergrad, med school, public health. So I'm a true blue Tar Heel. And then came to Winston-Salem. My husband's from here. We knew we'd want to settle here eventually. And so came here for training and started a practice and so on and so on.
Wow. That's pretty impressive. So when you say you, the president of?
Executive Vice President.
Mm-hmm. So what does that entail? What do you do there?
All right. So I am one of two physicians on our executive team reporting directly to our CEO. All right. And what I get to do is help to lead our teams who do all our clinical delivery in our clinics across our footprint. So Novant Health is a health system that is, a big portion of our operations are here in Winston-Salem. We have some in Charlotte, Salisbury, Thomasville, the Coast, New Hanover, and Brunswick. And so what I get to do is lead all of our teams who take care of our patients when they come to our clinic sites. Okay,
Wow.
so with whether it's annual exams, preventative care, specialty care, the operations, the strategy, that's my wheelhouse. So we have about 650 clinic sites across our footprint. And so my teams are the ones that help deliver that care. And then this past year, a lot of my work has been around COVID and setting up our screening sites and our vaccine rollout to the community.
Wow, that's impressive. Great to have you here during the National Women's Month. I was thinking about something, and I guess I wouldn't be fair if I didn't ask this question, right? I don't want to throw you an alley-oop. I have to ask you this difficult question. So when you look across the healthcare profession and you look at how it is dispensed and who has access to it, how do you feel about it when you look at it with your expertise? What could we do better to get it into areas where it is much needed? I've been having this conversation. I had it with one of the Dr. Speaks, and we were talking about trying to get some type of emergency facility in East Winston. And she told me that she was going to take that conversation back to the powers that be, the board, and see what kind of conversation that we could generate. And so having you here, I got to ask you the same question.
Yeah.
What do you think about that? Or do you think it's needed? How do we achieve that? Because a lot of people perish for the lack of knowledge, and sometimes they perish for the lack of access to resources and healthcare. And so I've always wondered about that, So
Not a curveball at all. This is what I think about. And, one of the things that's true to my core, the reason I get up every day, leave my family, do the hard work and the long hours is because I'm committed to our communities and to equitable access across our communities. And I'd say that, we know there's a lot about our healthcare system in general, end to end, that's a little bit broken compared to, ideal state. And so there's not a single easy solution, easy button. Healthcare, systems, physicians, clinics, we've contributed to some of this over time, right? The insurance industry, the government have contributed to this. The way that things have been set up around reimbursement have contributed some of these deserts for healthcare. We're putting clinics, so even our, Black physicians who come out and go into practice, we're more likely to take care of the community, go back to the community. but we are also more likely to get paid less because the reimbursement rates are lower, right? And it doesn't incentivize them to continue to put practices in some of the places where we need access. So we as health systems have to own that. We have to say we have resources, we have connections with payers and others, the government even, to say how do we make sure we have facilities in the locations that need them. And that's only one part of it, because one of the things that we've realized over time is we can put a clinic in a specific location, but if we don't really engage the community for education on why they need to access care, take care, preventative care even, build the trust with the community, maybe even include the services that are needed. So whether it's diabetes, nutrition management, special types of nuanced care, then we're missing the mark on having an impact. We put a building there, but it means nothing if the care we don't deliver is important. So I don't think you're off base at all. I think that the complexity around where hospitals are built, full hospitals versus emergency departments, our goal eventually is that we should put ourselves out of business, right? We don't want to fill hospitals with sick patients. We want the hospitals to be there for the people who need them, but also we want to keep as many people out of the hospital as possible, right? So I think that what we really need to start with is making sure preventative services, so primary care, and then those specialty care services, whether it's neurologists or cardiologists, that there is access closer to home for the community.
So how do we get these healthcare facilities in these areas where we need them? How do we do that?
Yeah, so I think it's a lot of things. So first, I would say most of us have our eye on what exactly, like, how do we do that? And we started engaging various community leaders to understand what does the community need? The nothing about me without me type of mentality, to bring people to the table to understand what the community feels it needs.
I like that. Nothing about me without me.
Yeah, and so it's bringing people to the table. We have a community engagement team that is constantly engaged with various groups and organizations to make sure we understand what do we feel the need is. And then it comes down to some of the business model of it. So how do we partner with the county or the city or other agencies to build something that may be innovative? Maybe, we are always looking to disrupt ourselves, right? Maybe the way we used to build hospitals, or the way we thought about access worked at a certain point in time, but to tackle a different issue and an access concern, maybe we need to do something different. And so I think you get our ear, we are constantly listening and trying to figure it out. And there's some people coming in that are forcing us to make sure that we actually are accountable, right? And that's a good thing. It's good for the community to hold us accountable for what we're doing.
Wow. So, COVID has changed the way we do business here. COVID has changed the way the world does business. How has COVID changed how you are operating in terms of what you do from your day to day?
Well, I'd say a good portion of what I do every single day revolves around COVID in some way, shape, or form.
COVID.
It's either, one, now we're really focused on vaccine rollout. We started it in December with our healthcare teams. In January, we started vaccinating the community. My teams are helping set up. We have a huge vaccine site over at the old Sears building at Haynes Mall.
I took my parents over there a couple of weeks ago.
It is phenomenal. They've done a great job. It's talking to the state around making sure we get the vaccine supply. So a lot of what we're doing right now is to make sure we get the community access to the vaccine. And I would say when you think about equity and things, we have team members that every day are talking to our churches, in the African-American community, the Latinx community, to try to make sure that we get this to the people. And it's much more difficult and it's slower, but it's high impact. And so that's a big portion of what I'm doing right now. The second part of it is, like you said, access to care. We've had so many people delaying care for the past year, whether it's because of fear, maybe it's financial, because they were financially impacted and can't get to or afford health care. That now we're starting to see the impact of that, where people are coming in at later stages of illness and disease, or maybe they're sicker, right? So we're getting back into that, making sure our clinics and our teams are there for our patients, and that our clinics are safe, and that our patients can access us, and figuring out how to even reach people who won't come in, but we still need to get to them, right?
Yeah.
Yeah.
So I was reading, and I saw it on the television, where in the African American community, there's a reluctancy of getting the vaccine. And so how do we break through that stereotype to say we need to get them because the data shows that we're being affected at a higher rate? How do we get access, or how do we give those people access, and how do we, as you said, share that information, that preventive care? How do we break through that wall?
Right. So there are two parts to this. I think that the media nationally, locally have done a good job of pointing out that surveys do show that African American community members are more hesitant to say they'll take the vaccine than maybe others. But they're now starting to highlight it's not just, I don't want people to think that African Americans not taking the vaccine is putting the country in jeopardy of getting past this pandemic. There are a lot of white male conservatives who also are saying from, for other reasons that they're not getting it. But we have been focused on what is the information that people are getting that's either correct or not correct. Yeah. And this history of distrust that whether people knew the word Tuskegee or the details of Tuskegee, if you've grown up in the Black community in the South especially, you just know that there is some caution when you're engaging with anyone from institutions, right? Healthcare and any institution. So we really have, this is where the partnerships come in. Some of our best work, 80% of our community members come into some of our community vaccine sites, which are at churches or Winston-Salem State. 80% are Black and brown, right? So we are successful with getting them there by utilizing our partnerships to both educate and to do the outreach and to put the vaccine in a place where they feel safe, right? The other part of this is to make sure that we continue to say, some people, it's not that they don't want to get it, it's just that it's complicated. We have all kinds of online forms that people can fill out. And what we realized in the first wave of this vaccine rollout is the digital divide for minority communities is real. There are many people who don't regularly email. They don't have an email, especially our senior population. They don't use computers. So when we were using internet and other ways, MyChart, to get them appointments, we weren't reaching them. And they wanted the vaccine. They just didn't know how to get it. Right. So even today, I'm sending emails to my team saying we need to constantly evolve how we have access and let people know how to get the vaccine to make it easier, right? Because some people want it. They're just having a difficult time getting to it.
Wow. So, when I think about National Women's Month, I think about the people that I've had this month, very impressive, including yourself. There's a young lady somewhere watching or see this program and say, I want to be a Dr. Oliver one day. I want to do this. From a small town of Rocky Mount, no shade on it, but from a small town of Rocky Mount, you've matriculated through many places and many institutions. What would you say, what would you give some person who is looking, saying, I too want to be her one day?
So I'd say I've been blessed along the way, right? I have been blessed from day one with a strong family that's behind me. I'm first generation college grad. My grandparents were farmers in Eastern North Carolina.
Okay.
So one of the things I credit to my, drive and success is that I grew up going to my grandparents' farm every day during the summer to help them with tobacco and cucumbers. It was hard work in the heat. And I realized then I was not cut out for that, and that I would do anything, study, stay in school to make sure that I had options, right? So my sense of drive comes from that sense of understanding what hard work is. My grandparents worked really, really hard all day long. They didn't have the luxuries that I have right now, but they were happy people. We would never have known that they were what we would consider poor, in every sense of the word. I also got that sense of community from Eastern North Carolina. People took care of each other. Mm-hmm. And so, a lot of where I credit my success along the way is I've been driven to constantly do better, be better. I've been driven to try to take care of my sense of purpose comes from helping others, whether it's one-on-one with my patients or if it's in this role, trying to figure out access for communities that need it. It's that sense of purpose. That's what gets me up every day. I wouldn't do this job in a year if I felt like that sense of purpose wasn't there and I wasn't getting that fulfillment. And so I would tell women, don't ever give up on yourself. Don't paint a picture or the future that you think is what somebody else wants, but truly strive for what it is that you want, and don't ever let anybody box you in.
Wow. So, I have a new perspective and a new outlook on healthcare now. Dealing with some health issues with my father over the last couple of weeks. And you said something that before we started talking about information and access to information. There's a lot of information out there that we miss sometimes, whether we don't have access to it or whether we don't value it when it comes from healthcare professionals. And going through this process with my father, listening to the doctors and the neurologists talk about certain preventative things that can prevent certain things that happen to us. And so, I want to first say how much I appreciate the healthcare providers. I appreciate persons like yourself who get up every day and make a difference. But I always go back to this thing about you know not, you have not. And I can't help but thinking that there are people in small parts of the communities who don't have access to it. And so I always hang my hat on is that how do we get to the least of us? How do we change the narrative of what we see every day? And I know that your hands are full and you have a lot going on from what I know and from what I've read. But I want to know, where do we begin and how do we start the movement toward getting those services in those areas where they're needed? Because when I drive down 40, I live in Clemens now. I grew up in East Winston. I grew up on 25th Street. Well, I was born in Happy Hill, raised on 25th. If I get on a highway right now, if I get on 40 headed west, and I get on at Cherry Street, right there off of Broad Street by the stadium, the next exit is Bowman Gray, right? 4 or 5 exits down is Silas Creek, Novant. If I continue west on 40, 2 or 3 exit is 184, 185, which is Harper, which is Clemens. And if I go another exit down to, it's Davie, right? I will have passed 4 hospitals in less than a 10-mile radius. But now, if I start east,
you got a gap.
I got a gap. And I'm always asking the questions, how do we mind the gap? How do we mind the gap? I was at Chick-fil-A and I tell the story all the time. In Clemens, there's a sign they have there and it says, you are responsible for closing the gap. And it says, use your app, move closer to the car in front of you. There's truly a gap. And when you think about trauma patients, they come out of that area, right? So why or when are we going to mind the gap in that area?
Right.
And I have to ask that question because to whom much is given, much is expected,
Right.
And I feel blessed that the people in God have allowed me to be in this space, in this place. So I have to ask the question for those, how do we start to move in closing the gap? And I love bringing what I call decision makers like yourself, Dr. Speaks, who you have the knowledge, you have the voice, you have the intellect, and more importantly, you have the connectivity to those that can make it happen.
Right.
And so I want to be a part of minding the gap, closing the gap. So I want you, if you can, to tell me, what do we need to do to start closing the gap?
Yeah.
Who do we need to call? What do we need to do? Because I've seen that gap, I know, in place for years.
And Winston-Salem is just one area of many, right, where this exists, right?
Oh, I know.
So I would say I appreciate that, and I'm going to offer myself up, and I'm going to hold you to that and figure out, who do we bring to the table across the community to help figure out what it is that we need, right? Because we had Cape B. Reynolds Hospital was the Black hospital
I was
for
born there.
Winston-Salem, right? And closed down. Good things about integration, great, right? what happened is all the healthcare then moves to a consolidated location, and it created a gap in East Winston. And one of my first leadership roles, I remember sitting down, and this was really talking about clinics itself at the time, was I asked, well, if you look at it, we didn't have much aubergine, that's our brand color, east of 52. There's a great divide there with 52.
Truly.
And so, I'd say lots of headway. We have Today's Woman, which was a clinic for OB and pediatrics that's targeting infant mortality reduction, which is horrible for Forsyth County and for the state. We have clinics for adult medicine, peds, and OB in Watown.
It is horrible for Forsyth County. The gentleman was on the show with us, and he talked about how in Forsyth County, how horrible it was. And I couldn't understand that, because this is one of the, in my opinion, and I'm sure the data will prove that, one of the richest counties in North Carolina. So how are we horrible or dead last or toward the end in that area when we have
two great health systems?
Two of the greatest health systems I know of.
It gets back to, and that's where when we sit down and we can talk with a community about what our goals are and how to get there, right? I hear you, and I want to make sure as we think about, is it a hospital or is it so much more than a hospital?
So much more.
And it is. And I think that the whole idea of what is the access that's needed from a healthcare perspective, because it is important. I think I went to school for all those years. The healthcare that we deliver is important. But we now are recognizing through the social determinants of health work that it is a fraction of what health outcomes end up being, right? And so there's so much more that we have to commit to as a community, whether it's economic development, it's preventing and then treating trauma, whether it's related to chronic stress, systemic bias, and racism. It's education. It is education of healthcare, concerns and needs. And how does all that play out to get us to the outcome, right? So it may actually be that there needs to be a facility, an actual acute facility, hospital, whatever, in east of 52 between here and Kernersville, right? Because when you get to Kernersville, you get more. It may be that that's the solution, but it also may be that money is better used to do many, many other things that actually have a bigger impact on health outcomes, right? And so that's where I think, there are lots of there are so many people out there trying to tackle those multiple facets of what impacts health right now. And I think it's great work. There can never be enough alignment of all that work to make sure we're having the impact. But for your question about like a hospital, so if it's a hospital, I would commit myself. I have conversations, our team, that's what we kind of figure out is what is the strategy for us? How do we partner with others? We have some great partnerships, whether it's with Wake, with the health department, the county. How do we partner together for our ultimate goal, which is to improve the health of this community and all members of this community? And what does that look like?
So I know that time is important to you, and I don't want to take all your time, but I was thinking as you were talking about a conversation I had with the health director for the county, and he and I were talking, and he was sitting across from me, and he was telling me that social determinants in one part of this county, the life expectancy is almost 15 years different than in another zip code in this county. And I asked the question, why is that? And he started listing a lot of things like poverty, access to good food, and then he said that healthcare and access to healthcare systems information. And so that 15 year didn't start out 15. It started out 1 year, 2 year, 3 year, and it kept growing. And while we're delaying and waiting on these people to bring to the table, we're losing a lot of people that, in generations, because you start talking 15 years, you're talking about generations then. What can we do? I want to be, as you said, if it's about me, include me, right? I want to be a part of the conversations. I want to bring people together who can make this happen. That's one of my, I have an accomplishment list of things that I promised myself and promised God that I want to do while I sit in this seat. Some of them are law enforcement related, some of them are not. And that is one of them, because I'm amazed how that gap, and it's almost like nobody really wants to address it. And we have the resources now, and I just believe in this thing in time and turn. Like, it could be your time but not your turn but not your time. But then every now and then, time and turn aligns, and it puts people like you in places to make the timing is now. And so I would love for you, whoever, to have conversation with the people that be, if we have to go handcuff them and bring them to the table, so be it, to have this conversation. I think it's a must.
It is.
I think we're late and we need to catch up. Yeah. Your resume is fascinating. You're a brilliant woman. And I think that with you and a few other people, it can happen. I mean, the time will never be like this again. The stars will never align like they are now for this to happen. And so I hope, the same thing that I'm going to say to you, I say to Dr. Speaks, I hope that somewhere along the way that you say, you know what, we're going to push this. We're going to push this. Because I see so many things happening that we could change the narrative. We could change the atmosphere. And like you said, it is so much more than just a hospital. It is so much more. Is information, is systems in place, is people seeing, a Dr. Oliver, a Dr. Speaks, knowing your story, knowing that you first generation, knowing that you worked in a tobacco field. Who would have imagined that? Knowing that now here you are, and here you was at one point in your life, and now here I am. There are so many people that need to hear your story. So many people need to know on that 52 divide and closing that gap. So I'm going to give you the last word as always. My mom told me always give a woman the last word. It'll make for a brighter day. So I'm going to give you the last word and let you say whatever you want to say and give us anything you want to give us as relates to this thing called healthcare and what you do. And we're proud to have you here in our city and doing what you do. I want to say that as well.
Well, I'm going to say I appreciate you for, one, having me here, but having this conversation, right? There's so much about this that's right. And I'll commit to you. I will lock arms with you, with your community, because this is that whole sense of who we bring to the table and how we think about it from a community perspective, right? And change the narrative. And understand that there are a lot of ands in there, right? It's not an or. It's not a hospital or. It's not. It's and this and that are part of the solution. So I'll commit to helping bring your network together with our network to figure out what it is that we do.
It's just,
yes, you do. Yes, you do. You have a huge network. I am sure of it. But whoever it is, your peeps.
Somebody tell me who my people.
Yeah, you got it.
I mean, if you're talking about the deputies and the team that works here.
This is what I tell people right now. And this is where, I've been blessed with a platform. And if I don't use my voice for good now, I might as well sit down, right? And so that is to whom much is given, much is expected. That is exactly it. So I would say, you're raising great questions. And I would say that many of us, whether it's the health department, it's Novant, it's Baptist, it's whomever, we all have been tackling this at different angles. And we have been engaging various community members, but we're not getting it perfect, right? We're not getting it right all the time. So we always need to be looking for new people to bring to the table, new solutions. And that's what I commit to saying. What have we missed and what do we do next, right?
Well, educate me on how to set this table and educate me. Once we finish this up, I want you to educate me on what I need to bring to the table and where I need to set this table. Because if you tell me what I need to bring and where I need to begin, I promise you I'll begin.
It's not complicated. I mean, it doesn't even have to be. We're not looking for, when we think about who's at the table, we need a diversity of voices, right? So it's not all people who are in power. We need people who are our community members who are struggling, right? They're concerned, they're scared. So we need community members. We need people who do have positions of power who can make things happen. So I think that table is really it's beautiful. You know, it's a little bit of everyone that can be there.
You know, my mind clicking, it's turning.
You got it. You got some people you're going to line up.
I promise you, it's clicking, it's turning.
But I think that we had this conversation with a group. I was really privileged on Martin Luther King Day to sit down with a group of community leaders to talk about the vaccine rollout for the community.
Mm-hmm.
And one of the things that, you know, they raise, we think, our teams think that they do a great job of engaging the community and hearing voices and trying to figure things out. I don't know that it always lands, and that we identify that we have opportunity to make sure that we are bringing people to the table early enough, right? So that people can be part of solution finding, instead of just once we've found solutions internally, we think we know what's going on, pushing it out, right? And so it was great. I want to continue that momentum with whether it's those leaders or others, and bringing you into the fold. So I'd say I go back to my team, where I see this looking like is I go back to my team and we look at what have we done and who are we engaging and how do we move forward more intentionally and maybe grow that table, you know, build a bigger table. You got a beautiful one here. I heard the story behind it.
Yeah.
But how do we expand the table to include more, and then think about those areas that aren't just about healthcare delivery, but all those other partners, because it's going to take a big effort. How do we do it? So I commit to you on that, to say, you know, we won't let the conversation stop today with you and I or with our networks, and that we commit to doing better, and that we align along the way on what our ultimate goal is. You know, I'm, as an OBGYN, our maternal mortality rates, so women who die in pregnancy or during childbirth, are not like, you know, significant in this area. But nationwide, it means me with a professional degree, with a great job, with a good lifestyle, I'm just as likely to die as an African-American woman in childbirth as a white woman with a high school diploma. And that's where when you start looking at solutions, you start looking at infant mortality. It's not just about the prenatal care and that someone has it. It could be about the experience they have. It could be about the chronic stress and the racism that they're experiencing in their communities. It could be about education. There's so many other factors that play into it, that's why I say, you know, I'm committed to saying whoever can help us with solutions, it's going to take one bite at a time to, you know, eat the elephant and chunk away at the elephant. And we're committed to being part of that and leading that in any way we can. So I appreciate you being willing to come to the table with us on that.
Well, I appreciate you, and I want to thank you for coming and stopping by today and joining us at Off the Cuffs. It has truly been a pleasure, and I've learned and been enlightened on some things, and you got my wheels turning. I want you to know that anything you need from your office or the people, the sheriff's office, that we can do, we'll be there, and we're committed to furthering this conversation. As always, thank you for coming, and thank you for joining us at Off the Cuffs.